Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the November 5th, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County and just about the entire state of Iowa continue at high transmission for COVID-19, with the COVID case rate for the last 7 days in Dubuque County at 469 per 100,000 population and a 7-day positivity rate of 12%. Back at the end of September, the rate was 175 per 100,000 population and the 7-day positivity rate was 5.5%. Back then, I stated that we were making little progress on turning the curve downward and that unvaccinated people, including school-aged children, continued to fuel that latest surge. Here, we are over a month later and our transmission rate and number of cases are significantly higher than back in September. Why is that? Well, schools cannot require mask wearing, and therefore most children in schools are not wearing them. It could also be that whether we're vaccinated or not, people think the pandemic is winding down or they're not at risk and therefore go to crowded indoors places, events, or in-person meetings without masks and social distancing. Of course, there are breakthrough cases in fully vaccinated individuals, which new research has shown that immunity does wane over time, even in fully vaccinated people, or in those who have had COVID disease. Maybe people who are symptomatic think it's just a cold or allergies or avoid getting tested for fear of finding out that they may be COVID positive and then have to stay home for 10 days. All of these factors are happening at once. Children age 5 to 11 just got the go-ahead to be vaccinated as the Pfizer vaccine for this age group was approved by FDA and CDC. It will take time for these vaccinations to be effective since they require 2 doses, 3 weeks apart, and are not fully protective until 2 weeks after the second dose. That puts us into mid-December before the first children being vaccinated are fully protected. In the last 7 days, the 0 to 17-year-old age group accounted for 29% of COVID cases in Dubuque County. And there are still a lot of children in the 12 to 18-year-old age group that are not vaccinated, which is contributing to the spread in schools and among school-aged children and staff. I know it's difficult to keep wearing masks, especially in school all day, but the fact of the matter is, when I'm asked about masks, if they're worn consistently and appropriately, they do provide some level of protection against spreading COVID-19 and getting infected. Just because you're vaccinated, there's still a slight risk for acquiring the virus and spreading it unknowingly. So let's talk about that booster dose. Those eligible to receive the third booster dose should do so as soon as possible. And these groups include those 65 years of age and older, and anyone 18 years of age and older who either live in long-term care settings, have underlying medical conditions, or work or live in a high-risk setting. So what does work or live in a high-risk setting mean? People like adults who work or reside in places like healthcare, schools, correctional facilities, or homeless shelters. First responders like healthcare workers, firefighters, police officers, and congregate care staff. Education staff like teachers, support staff, and daycare workers. Food and agriculture workers, manufacturing workers, corrections workers, postal service, public transit, grocery and retail store workers. People in these kinds of categories should seek a third booster dose 6 months after their second dose. Or if they've received the J&J vaccine, the booster dose can be given 2 months after their vaccination and can be with either Pfizer, Moderna, or J&J vaccine. The final thing I want to emphasize is how do you know when you should be tested? This can be challenging this time of year with a lot of this different respiratory viruses, allergies, and the common cold circulating, not to mention the upcoming influenza season. Don't assume these things are not COVID, which has a long list of potential symptoms, and you don't have to have all of them to be infected. In fact, you may only have a headache or lose your sense of taste and smell. You may have a runny nose or cough. These symptoms should cause you, at the very least, to stay home and away from others while you're ill. If you become ill due to an exposure to a positive case of COVID, or you put yourself in a risky situation to catch COVID-19, you should seek testing and stay home. It also doesn't hurt to be tested with any of these symptoms, regardless of whether or not you've been exposed. And while you're waiting for test results, you must continue to stay home or risk spreading COVID or whatever illness you have to others. So don't get a COVID test and then go to work or school. Wait for the results to determine if it's safe. Another situation is if you're fully vaccinated and have had an exposure to a positive COVID case, it's recommended that you get tested 3 to 5 days after that exposure. And there are several different options for testing. If you're asymptomatic or you don't have ill symptoms, but have had an exposure or maybe a potential exposure, the Test Iowa Take-Home Kit is a great option. And you can pick these kits up at most healthcare providers and pharmacies, along with the VNA and the Dubuque County Health Department. They are free, and all you have to do is sign up online on the Test Iowa site, spit in the test tube provided in the kit, and send it back via a UPS drop site. All of these are free, and results are usually provided back via text or email within 24 to 48 hours. If you're symptomatic, you can call your doctor or healthcare provider or visit an acute care clinic. And anyone can seek testing at some pharmacies, so check the city or county websites for the latest information on local testing. And finally, last week in Iowa, the unvaccinated accounted for 74% of hospitalized COVID-19 patients and 82% of ICU hospitalized COVID patients. The fact that the COVID vaccine prevents severe illness and death is clear. And new research demonstrating that immunity from vaccination provides better protection against COVID symptoms and hospitalization than natural immunity to be infected with COVID-19 is just out. Schools have impacted this surge, and unfortunately, not all children 12 years of age and older have been vaccinated or even started their vaccinations. Now that we've had time to show the side effects are minimal to children 12 years of age and older, it's time to get the rest of these children vaccinated to create a more safe school and home environment. So we're embarking on the holiday season coming up in just a couple of weeks. Think about that, because if you want to be with friends and family or even travel over the Thanksgiving holiday, now is the time to take extra safety precautions. When transmission is high and you have a high risk of getting infected or having a breakthrough mild infection, it's a definite possibility. So you don't want to be isolating during the Thanksgiving holiday and miss all the fun. So in the next couple of weeks, for sure, be safe, wear a mask, get vaccinated if you haven't already done so, and avoid crowded indoor events, especially if they last a long period of time. Have a great weekend, everybody.